car.ca.
You're watching Rogers TV, Barrie.
Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide you with the COVID-19 update for Simcoe Muskoka. As of today, we have 14,400 cases in total, up 286 cases from last week when I last reported. We have had actually a 95% increase week over week over the last 2 weeks. So for the week of October the 31st to November the 6th, we had 248 cases compared with 127 cases the week before. And at the same time, the province has also had an increase for the first time in the past 6 weeks or more. At a 31% increase over the preceding week. So if we reflect on this, we've actually had 4 weeks in which there was a gradual rise of cases. So if you go back to September the 26th, we were down to 98 cases. And we went up the following week to 135 cases, and then back down to 111 cases, and then up to 122 cases and 127 cases, and then last week, 248 cases. So a gradual rise over a month, and then a very steep rise, essentially a doubling of our case count over the last week. We've also had one death in the past week, and I would like to express my condolences to the family members for your loss. This is a man 80 plus from Muskoka, a sporadic case, community acquired, an individual who is fully vaccinated. In terms of hospitalization, we have 20 people in Simcoe Muskoka who live here who are in the hospital with COVID-19. And this is down from 21 cases last week. And we have 4 people in the intensive care unit, which is unchanged from last week. So their ages range from in their 20s to their 80s. They're all from Simcoe County. 5 of them were community acquired. 3 were close contacts of the case. 8 were part of an institutional outbreak. 1 was travel related, 1 under investigation, 1 acquired in a community setting out of community outbreak out of jurisdiction, out of Simcoe Muskoka. 2 are part of a congregate setting outbreak. And when we consider them all, 6 of them were fully immunized, 12 of them were unimmunized, and 2 were partially immunized. To date, today, over the past 24 hours, we have 63 new cases. So that's very high. That takes us back to wave 3 when we had case counts in a single day in that level. So 54 of them are sporadic cases. 6 are part of school outbreaks. And 3 are part of congregate setting outbreaks. 31 are male, 32 are female. Their ages range from under 10 to in their 90s. 22 of the 63 are children below the age of 18, so 0 to 17 years of age. 60 are from Simcoe County and 3 are from Muskoka. With regards to their acquisition, 30 are under investigation, 20 are close contacts of a case, 4 are community acquired. 6 were part of an outbreak in an educational setting. 3 were part of outbreaks in congregate settings. All of them are self-isolating, not hospitalized. 26 were not vaccinated, 1 partially vaccinated, 20 fully vaccinated, and 16 not eligible to be vaccinated due to their age. Being too young. If we look at where we find the location of our active cases, they are residing primarily in Barrie, Bradford, West-Gwillimbury, Innisfil, and New Tecumseh. So for the week of the 31st of October, Barrie has now the highest weekly incidence of cases per municipality in Simcoe Muskoka at 85 cases per 100,000 population per week. And this is more than double the rate that they had from the previous week, so a rapid rise. Essa and New Tecumseh and Innisfil all had weekly incidences above 40 cases per 100,000 population per week. So Barrie's incidence has been increasing over a 4-week period. It was 25 cases per 100,000 population in the week of October the 10th. As a whole, for Simcoe Muskoka, our incidence is 41 cases per 100,000 population per week, up from the previous week of 21. So essentially double from what it had been the previous week. And the province's rate is up to 22 cases per 100,000 population from 17 cases per 100,000 population per week the week before. For the week of October 31st, 18% of our cases were children under the age of 12, so people who cannot be immunized. With the majority of these in school-age children 4 to 11 years of age. And this is down from 25% the week before. And 25% of our cases are community cases where we don't know how they acquired their infection, compared to 29% the week before. We presently have 17 outbreaks, up from 11 last week. So 7 of these are ongoing as follows. An educational setting, Holy Cross Public School, declared October the 15th with a total of 29 cases, up from 27 a week ago. Another education setting, Assakenakan Public School in Barrie, declared on October the 22nd, totaling 17 cases, up from 15 cases a week ago. A hospital, or VH, with outbreak declared on October the 29th, a total of 12 cases, unchanged from a week ago. And in long-term care facility, the Pines in Bracebridge, outbreak declared on October the 30th, 2 cases, unchanged from a week ago. A shelter, congregate setting in Simcoe County, outbreak declared on November the 1st with a total of 21 cases, up from 2 cases a week ago. An educational setting, St. Catherine's of Siena, declared November the 1st, total of 9 cases, up from 7 a week ago. And a recreational facility in Simcoe County, declared November the 2nd with 2 cases, unchanged from a week ago. We have the following 9 new locations. A congregate setting in Simcoe County with 7 cases, an elementary school, VK Greer with 2 cases, a private school in Simcoe County with 2 cases, a secondary school, St. Pete's in Barrie with 5 cases, a community setting religious organization in Simcoe County with 14 cases, a childcare setting, Simcoe County with 3 cases, another childcare setting, Simcoe County with 5 cases, and an elementary school, Willow Landing in Barrie with 3 cases. One thing I would preface is in some instances, for example, the religious organization, we may have other cases that are individuals who do not reside in Simcoe County that are associated with that outbreak. And so that number is not included in the 14 cases that I cited. And then we have 4 outbreaks that have been declared over in the past week. A long-term care facility, Mill Creek Care Center, declared on October the 15th, a total of 3 cases, but now declared over. A correctional facility declared on the 18th of October, the total of 16 cases now declared over. An educational setting, Portage View Elementary School, declared on October the 12th with 2 cases and now declared over. And an educational setting, Monk Public School, declared on October the 25th with 3 cases, now declared over. In terms of immunization, we continue pursuing the goal of 90% coverage for first and second doses for all who are eligible, 12 and above. And at this point, we have achieved 87% first dose coverage and 84% second dose coverage, which is up from 83% a week ago. The lowest coverage is among adults 18 to 25 years of age, and in particular men. And a total of 10,228 Simcoe Muskoka residents have received a 3rd dose, booster dose of vaccine. From our data, the COVID infection rate among unvaccinated people is 8 times higher than for those who are fully immunized. And the rate of hospitalization is 9 times higher for those unvaccinated versus those that are fully immunized. So this is from September the 5th to October the 30th, data from Simcoe Muskoka. So if you look at our cases in the week of October 31st, 30% of them were fully vaccinated, 65% unvaccinated, 6% were partially vaccinated, like a single dose of vaccine. If we look at our monitoring dashboard, we are in yellow status, red for virus spread and containment due to the rising case count incidence. And we have a reproductive number of 1.4, which is actually slightly down from last week at 1.5. Anything above 1 indicates growth in the pandemic in our population. Laboratory testing, green status. We do have an increase in our percent positivity now, 2.7%, up from 1.8. Certainly above 3% is of concern. And basically, this is an indication both of the amount of transmission happening in the community, but also the sufficiency of the amount of testing taking place. Also, 1-day turnaround time for laboratory tests is in the desired target range of 60% within 1 day and 80% within 2 days. Health system capacity is yellow from previously had been green. We do have some increase in acute hospital bed occupancy, but this is unrelated to COVID-19 cases. And the public health system capacity is in red. This is due to us being challenged in our ability to keep up with the cases. We are reaching 74% of our cases within 1 day, down from 80%, our target being 90%. And the contacts, 81% being reached within 1 day, which is up from 71% last week. So some key messages. Indeed, we are experiencing a surge in transmission in Simcoe Muskoka after a gradual increase over time. We now have a marked increase. And I think it's important for people to be aware of that and to be aware of the increased risk of transmission in the community, and that they need to take to heart the protective practices at their disposal to reduce the risk of transmission to themselves and to others. It's certainly important that we understand to the best of our ability as a health unit as to what's happening and try to characterize transmission to better understand it and to communicate that to the public. As I've noted, we've had this gradual increase over time and then a marked increase over the last week. We've seen children under 12 years of age who cannot be immunized, representing a larger proportion of the cases in wave 4, including now compared with the previous waves. I think that this speaks to the importance of immunization, the fact that it's those who are not immunized or cannot get immunized who are representing the majority of the cases and are most vulnerable to becoming cases. I think, though, it's important to note that we do get breakthrough cases as well. While vaccine provides the best protection people need to continue with the other practices, even if immunized. So this does include mask use and physical distancing in indoor public places and workplaces, self-screening and exclusion from work or public settings and seeking testing and assessment if you have symptoms. I would say at this time, it's also important to consider your social circle and to be aware that there's more transmission happening. It's safer to identify a smaller number of people to be in close contact with in your life and stick to that smaller group of people. We're allowed 25 people in an indoor public private setting such as your home, but that would be a large number of people to have together and that would increase the risk of transmission. It's better to have smaller numbers and to be aware of the vaccination status of people as well. We're also challenged as a health unit, as I noted in a press release, in our ability to be able to keep up with the cases and their contacts, and are now having to do some prioritization, asking cases to follow up with their contacts and notify them and advise them they've been a contact, and if it's a high-risk contact, unimmunized individual, that they need to be in isolation, immunized contacts to seek testing and to self-monitor for symptoms and to isolate if you develop symptoms. That we are prioritizing outbreaks in certain settings that are vulnerable, including schools and congregate settings, and are limited in our ability to be able to get to all clusters of cases in order to determine whether or not they are outbreaks. So we will be providing in the very near future guidance to workplaces about reducing their risk when transmission is occurring, and in particular, if they see that they have some cases in their workplace, what they can do to reduce the risk of transmission. And we'll keep that information up on our website, and I'll be speaking to that as well. Certainly advise that people who haven't been immunized to get immunized, to become fully immunized, and when eligible to seek booster doses. So at this point in time, those that are 70 and above, those who are healthcare workers working in contact with patients or work in a healthcare setting in which there are patients, those who had AstraZeneca vaccine for the first and second dose, and adult members of the Indigenous population and their household members, whether or not they're Indigenous, would all be eligible to receive a booster dose 6 months after their second dose of immunization with an mRNA vaccine, Pfizer or AstraZeneca. So I certainly advise that people who are eligible to seek out that immunization. Why are we seeing an increase in the cases at this time? Well, when we look at the data, we note a few things. First off, we have multiple outbreaks, many with children who are not able to be immunized. So we're reporting 17 outbreaks today. including among those who are not able to be vaccinated. So 7 elementary schools, 2 childcare centers, 1 community center, sports and recreational facility. And we also note 1 secondary school and a private school that had been an outbreak, a hospital, a long-term care facility, a place of worship, and 2 congregate settings. So places that house young children are particularly affected, but also certain other settings as well, as I've identified. And we note the increased proportion of our cases that are among children who cannot be immunized compared with the previous waves. So we do note other locations where there have been exposures, where there have been 2 or more cases occurring. And I just flag these as environments in which we've seen exposures for public awareness. We've seen some food premises. We've seen a recreational facility. We've seen 2 motel, hotel, and short-term rental locations. We've seen some multi-unit dwellings, private residences that have been affected. And we've seen other places of worship as well, in which there have been some individuals who have been cases who attend those places of worship, and also some workplaces. So it shows that there are a variety of places now in which exposures are happening, and really speaks to the importance of people, A, being immunized, and B, abiding by the protective measures of the distancing, the masking, and self-monitoring and exclusion if you develop symptoms. And abiding by any other requirements of those premises, such as providing upon entry for those that require it, documentation of your contact information for follow-up if in fact they become identified as part of an outbreak. So we're also contemplating that there's a potential, as an explanatory point, for people to be relaxing possibly their practices with regards to physical distancing, and feeling a sense of security about being fully immunized, thus leading to the potential for more exposures in the community or in their social lives, and that this might be part of what's happening with transmission. We do note the breakthrough cases that have already identified, and that does speak to the fact that vaccination alone, while being the single most important protective thing you can do, is not sufficient. You need to continue with these other practices, and we need to certainly do that with children who cannot be immunized, to have those around them vaccinated and abide by all the practices I've cited, plus the practices that are in place at school, and certainly screening your children for symptoms and not sending them to school if they've developed any symptoms or are identified as a contact of a case and have been identified as needing to stay home because they're a contact and unimmunized. We've also had some impression of, with regards to the follow-up of contacts in cases of non-compliance among some of the confirmed cases. And this would speak to pandemic fatigue and the increasing difficulty that we all have in managing the restrictions on our lives associated with the pandemic. And so I've asked if people find it within themselves to continue with the practices that we need to do. We will be providing in the near future some recommendations about social gatherings leading into the holiday season. So just flag that as information coming your way, but I would position at this time with rising case counts that, as I said before, please abide by all the protective measures, and I would recommend that you choose to keep a smaller social circle of a dedicated group of people at this time. So with regards to booster dose availability, I've already cited the groups that are eligible for that, and booster appointments can be made at the Barrie Immunization Clinic at 29 Sperling Drive, the old police station. And other community clinics will be open as of November the 15th. On our website, we'll have some information about that, and people are able to book online via the provincial booking system at this time for that. And booster shots can also be obtained by participating pharmacies, and there is a GoVax bus, mobile clinics that are helping to provide immunization. Some participating primary care practitioners are also doing this, and for healthcare workers, a number of healthcare facilities are providing this, such as the hospitals in Simcoe Muskoka, for their employees. In accordance with what our Chief Medical Officer of Health, Dr. Kieran Moore, has been saying, fully immunized people receiving the first 2 doses have received powerful, persistent protection against COVID-19. And so while we're advising that it would be prudent to receive a booster dose, there's not an urgency to it. And so therefore, people please to exercise some patience with regards to being able to book it and get in and get it done. Okay. Flu vaccines are also available at this time. They are recommended for the entire population 6 months of age and above. Influenza last year was very uncommon due to the protective measures. We've now opened up much of society with no gathering limits, capacity limits in a variety of settings, such as restaurants, and provided that people have proof of immunization against COVID-19, they'd be able to take part of those premises. And in doing so, influenza would become more of a risk. A mask certainly helps with influenza, but immunization is another form of protection that we always advise people to take. And there are particular groups that are at higher risk of severe outcomes from influenza, and they are as follows: people who are pregnant, those who reside in nursing homes and long-term care facilities, those that are 65 years of age and older, children between the ages of 6 months and 4 years of age, the Indigenous population, and those with chronic health conditions, as well as healthcare providers who would have a duty of care to protect their patients by receiving influenza vaccination. So people would be able to receive immunization, many through their primary care practitioner or through community pharmacies, or for those working in healthcare, often they can receive it at their healthcare facility or premises, and those that reside in long-term care facilities should be provided with the vaccine where they reside. We have had questions on an ongoing basis about schools and the investigation of school outbreaks and school closures. So as I said before, we strive to protect the school environment, have it a safe environment, and keep schools open because of the importance of education in person for the mental and physical well-being of children. And there's much that has gone into keeping the school environment safe, but we are seeing outbreaks in particular in primary care schools, the environment in which children are not vaccinated, cannot be vaccinated because of their age. And so it's very important for parents to screen your children before they go to school. and to exclude them from going to school if they have symptoms or if they've been identified as being a contact of a case and your child has been required not to go to school and to seek testing for follow-up. We do all that we can in our outbreak response to identify cases and their contacts, to exclude them from school, to arrange for testing, and to keep the schools otherwise in operation. Closing school is an option for us. It is a resort that we reserve as a last case if absolutely essential, but otherwise strive to keep schools going. So as I indicated about holiday parties and gatherings, we are getting questions about that. We are going to be providing written recommendations about that in the very near future. But in my own opinion at this time, as we see rising cases, in addition to the typical control measures that people need to take on, vaccination, masking, and physical distancing in public settings, indoors and workplace settings, self-screening and self-exclusion and testing if developing symptoms, that people also consider a smaller social circle, dedicated group at this time as an additional protection. So at this point, I'd be happy to take questions.
Thank you so much for your update today, Dr. Gardner. We will now take some questions from the media. As always, we do ask that you kindly limit yourself to one question and one follow-up in consideration of time. Can we start with Brett Glover from Barrie 360? Do you have a question today?
Thank you very much. Doctor, I know you touched on reasons why case counts are generally on the rise, but what do you think it is about our area specifically, Barrie, Southern Simcoe County, that could account for the greater number of cases per 100,000 compared to other regions?
I don't have a definitive answer to that. I mean, we've got the data that I've spoken to and identified something of why we think we're seeing the rise happening here. Why it has risen here sooner than the province as a whole and why it is quite a bit higher than the province right now, I don't have the definitive answer for that. When I look at across the province, I do see an interesting pattern. The parts of the province that were hardest hit for most of the pandemic, the Greater Toronto area in particular, now have lower rates of transmission. Certainly, they were prioritized early on to receive immunization, and they had hotspot neighborhoods to receive more immunization early on, and they did succeed in achieving high rates of immunization early on. We had always had low rates of transmission, half the rate of the province through the pandemic. We generally were lower priority to receive vaccine early on, so our vaccination rate is a little bit behind the provincial rate. We go up at a slightly more rapid pace than the province, so that gradually catching up to the provincial rate. But it's possible that we're seeing the effect of vaccination that's a little bit delayed compared with those prioritized parts of the province. And I do note that other parts of the province that have had led in rising cases have been more on the periphery, not in that urban core, but elsewhere in southwestern Ontario and in Kingston, now very much in Sudbury and Algoma. Those more peripheral areas that perhaps had lagged early on in the provision of vaccine might be part of the explanation, but maybe not. I don't really know for sure.
Fair enough. And we're just over about 2 weeks out of a major change in restrictions province-wide, the lifting capacity limits at venues like restaurants. Now, with the surge in new recent cases, did the lifting of those restrictions come too soon?
I think that it's important for the province to know what's happening given what they've done. They did stage it. It did come a little bit after commencing school. They're set to do more opening on the 15th of November. And in my opinion, they should actually postpone that the venues that they would be opening include higher risk activities such as dancing, but also bathhouses, strip clubs, and sex clubs. And so those would be higher risk settings, higher risk activities. If we're seeing transmission going up, I think it would be good to postpone that. Also, it would, I think, send a message to the public that we, in our daily lives, we need to take precautions. And therefore, the province would be taking a precaution of postponing that particular step. So we're experiencing what we're experiencing now. I would recommend that. I would recommend a reinforcement publicly of what people need to be abiding by. And as a health unit, we are looking at, given the pattern of transmission and where we're seeing it, whether there's additional requirements that we would put in place. So that's something that we're working through right now.
Thank you for your time.
You're welcome.
Mary Beth Hartle from Muskoka Region, do you have a question today?
I do. We have folks very excited because they're allowed to have a Santa Claus parade coming. Are we concerned about outdoor events such as that? I know you said that there's notification coming on people having Christmas events indoors, but are we concerned about the gatherings that are bound to take place as people get excited about the holidays?
I am concerned about social gatherings indoors. And certainly people being able to gather up to 25 in a home could easily lead to transmission. And certainly household transmission happens. We've seen that with the primary school outbreaks, that siblings have become cases that have further complicated those outbreaks with more classes being affected. So transmission in the home is certainly something of concern, and with social gatherings, there is the potential for that kind of transmission. We didn't see it in our data that was obvious to us with regards to Thanksgiving this year. We did see it last year, and we did see it at Christmas last year. So the potential is there. So that's the indoor piece. An outdoor event like a parade, the requirement from the provincial regulation is people use masks if they cannot physically distance. While attending that, the outdoors is a safer environment, but not completely risk-free. And people do need to exercise that precaution. I always advise vaccination as something foundational for them. Awareness that young children at this point can't be immunized. We anticipate that changing soon, but not, I don't think, in time really to make parades for Christmas, for the holiday season, safer for young children. So people do need the masking, the distancing, awareness, screening as always, and not going out if you develop symptoms. The outdoor environment is safer than the indoors, but they still need precautions. And if they're going to have a social gathering associated with events like the parade, they've got to exercise their caution as they've identified.
Excellent. Thank you so much.
You're welcome.
James Bowler from Cogeco, do you have a question today?
I do. Thank you very much. Dr. Gardner, we heard earlier this week, Minister of Health and Deputy Premier Christine Elliott speak about how we could be seeing regional restrictions depending on the numbers. Looks like Simcoe Muskoka is not heading in the right direction right now. So yeah. Are you considering that approach moving into the holiday season?
We are looking at what additional restrictions we would put in place. We're working through that process right now. Certainly well aware of the very broad restrictions put in place by the Medical Officer of Health in Sudbury. Now, they have much higher rates of transmission right now than we have, but we need to be aware of what others have done and be aware of the fact that we could end up at that kind of a level of transmission if we're unfortunate. So we have that in the back of our mind, but we are otherwise looking at some other measures that could be done to address transmission among younger people, in certain gatherings, looking at settings, looking at what's already in place with the Reopening Ontario Act, the kind of requirements that are there that just need to be strengthened and made clearer in those settings. So the requirement for mask use, for documenting the attendance, for screening for symptoms in those settings, we're looking at the potential to reinforce that.
So in terms of those restrictions, I think about the ski hill here in Huntsville, and they're looking forward to a season where they have people outside with no masks and very little kind of restrictions in terms of distancing and things like that. But is that something, and going back to Mary Beth's question as well, could it possibly turn around within the month that we could see these heavier restrictions come into place in terms of ski hills now having to have people further apart and masked together again when they're outside, and outdoor events also getting affected, like the parade and Bracebridge?
Yeah, we would be primarily concerned with what we're seeing, which is more the indoor exposure pattern. So the lodge may very well be an issue, and how things operate in the lodge, and the need for people to wear protective face mask and while in that premises, and for people to be able to be physically distanced would be important, much more so than the outdoor environment.
Thank you.
You're welcome.
Mo Fahim from Muskoka Now, do you have a question today? Okay. Mike Arcelides from CTV Barrie, do you have a question today?
Of course. Good afternoon, Doctor.
Good afternoon.
So on October 13th, you said, you know what, maybe this isn't the best idea doing everything all at once here. Have you spoken with the province or the medical officer of health, or both, about perhaps changing the way we're doing things here? Were Halloween parties a factor here? Churches, folks sitting in the pews without their masks on, thinking they were going to be okay because they're double vaccinated. What types of things additionally would you want to see implemented right now to get this back under control, where people have that false sense of security that everything's going to be all right and we're going to be all merry at Christmas time?
I advise that people need to take to heart the standard recommendations about getting immunized first and foremost, wearing masks and physically distancing in indoor public spaces and workspaces, self-monitoring and screening and exclusion, and seeking testing if you develop symptoms. So on an individual level, I continue to advise that. I would be concerned about the province proceeding with further lifting of capacity limits, which they may do for the 15th of November. I think it would send a better message to the public right now with the rising rates that they would hold on that. I intend to come forward with some recommendations on our website that I will speak to in a week about holiday gatherings. But at this point, I would advise, given that we're seeing a rise in cases, that people maintain a smaller social circle of a specific group of people, and that they be aware of people's immunization status with regards to indoor social gatherings now and going into the holiday season.
So essentially what I'm trying to get at is, without you making yourself out to be the bad guy in the eyes of small business and folks who have suffered dear, what is that balance that you would like to see struck here? Because according to businesses and advocacy groups, they're saying there's no evidence of transmission in restaurants where it's just a couple celebrating their anniversary, taking their masks off, fully vaccinated, eating for 45 minutes to an hour, and then leaving. It's the gatherings, it's the household, it's the kids coming from karate class and hanging out, and that false sense of security. Is that what we are seeing as the main source of transmission here? And would it be unfair to roll back those capacity limits on those small businesses where they're saying 8 from here?
Well, to date, I have not advised rolling back on the capacity limit lifting that has taken place to date. I am advising on a go-forward basis that there be no further lifting at this time of capacity limits while this transmission continues to elevate. We are monitoring closely what's happening here. I do note in Sudbury that the medical officer of health has reinstated capacity limits that have been in place earlier. At this point in time, we're not proceeding with that. We are monitoring that. Certainly in the past, there has been evidence of transmission in a wide range of business settings, including restaurants and gyms. Not necessarily here, but elsewhere in the province. In some instances, some types of businesses, we've seen it here. So it's important for people to be aware of that, for businesses to be aware of that. The proof of vaccination approach is an important one to help reduce the likelihood of that. And so I applaud the province for having put that in place in the first place. And I would certainly advise businesses to implement it, to abide by the requirement to implement it, and to implement all other requirements under the Reopening Ontario Act or under my letters of instruction to safeguard their businesses with regards to their employees as well as their clients and customers.
Thank you as always.
You're welcome.
Can we go with Sean Gibson from Barrie Today? Do you have a question for Dr. Gardner?
Hi, thank you. Just about the Mapleview Church, a recent email from the church has said that they are going to have online service this weekend after having spoken to the health unit previously, I believe, but that they fully anticipate being back in service on the 21st. Who makes that call, and at what point are they, I don't know if allowed is the right term, or when are they allowed to do that, and whose call is that?
So given that we've declared an outbreak, ultimately, it would be our decision what protective measures need to be in place for the management of that outbreak. And the dates of such would ultimately depend on what happens with the outbreak, how well it comes under control and how quickly.
And then just secondly, and I know that there's a lot of talk about, privacy concerns and things of that nature, but this is one of the largest churches in the city, if not the largest. It hosts countless events in the building and around it for the last few months and over the last year as well. There's no mandatory sign-in for this building. There's nobody keeping a mandatory tracking system of who's coming and going into this building, which is constantly busy. The pastor of that church is on video asking members of the congregation to be deceptive as they leave the service in case there's a bylaw officer outside. There are countless emails coming to us asking, where is the accountability for this church? Why isn't it that they're not being accountable, but other places of business have been held accountable anyways, that we've seen over the last year and a half? Is there a difference here, or what can we know about what's happening at this church?
So we are investigating, and not only that, but we're considering what requirements that we would make for faith-based services as one of the locations where we've seen issues of concern, this particular outbreak, and to make very clear what their requirements are to safeguard those environments. So I would acknowledge the concerns that you raise, and as indicated, we are investigating not only from the point of view of managing this outbreak, but what we would require and what we'll communicate in the future for faith services. And we need to consider settings that would be similar to that because we need to apply disease control measures and thinking to our approach to reducing risk in the community at large.
Perfect. And I just want to ask one more thing. I don't usually do this, but what would you say to, I can say with confidence that there are members who want to speak up, but are not speaking up, are afraid to speak up for whatever reason. What is their course of that? If they want something done about the church that they're attending, what can they do without having to reveal their names? Who can they approach and what help can they get? Because they're watching right now.
They can certainly notify us. They can contact us. We have our Health Connection service to receive calls from the public. At times, it can be a wait, half an hour even, or longer to get through on the line because of the busyness of the calls. Email is another way, although less anonymous than a phone call. They can choose not to reveal their name if they wish.
Okay. Thanks again, Dr. Gardner.
You're welcome.
Erica Engel from Collingwood Today. Do you have a question?
Yes, thank you. Dr. Gardner, earlier today when you were talking about cases and trends in cases, you mentioned some non-compliance. Are you referring to like people who have been identified as cases not complying with staying at home, or is it non-compliance with like health measures? Are they going out sick kind of thing?
There have been instances all the way through the pandemic of some individuals who have not complied with staying in isolation, returning to work, for example, in which case we've had to issue orders to ensure compliance. There have been other instances where they've been unwilling to disclose the names of their contacts, and we really don't have much recourse when that happens. And there have been instances where individuals have said that they just don't want to comply, or they refuse to answer the phone, or their contacts refuse to answer the phone. So we're finding as time goes on, it can be increasingly difficult with pandemic fatigue to get cooperation.
Okay. The other thing is you've mentioned that the increase in, I guess, what used to be called breakthrough cases is in part related to now there's more people vaccinated, so there will be more people in that group. Are you seeing any indication of the immunity from a vaccine decreasing as time goes on as well?
When we look at our data, we don't clearly see that shown with regards to the timing of breakthrough cases after their full immunization, their second dose. And so it's not clear to us from our data that we're seeing waning immunity as an issue. And therefore, I think the breakthrough cases that we're seeing are simply that their vaccination didn't provide them as individuals with a full degree of protection against infection. And really, we have to look to the research on the topic in order to get a better understanding of when and to what degree waning immunity occurs. And what is apparent from the research is that it's more of an issue for those that are 70 years of age and older, and in particular for the prevention of symptomatic disease rather than the prevention of severe disease. So they still have ongoing protection that doesn't appear to be waning with regard to severe disease, but they can end up becoming symptomatic beyond, say, 4 months, 5 months of full immunization. So that's more for older people, and in particular, people in long-term care facilities.
Thank you.
You're welcome.
Chris Simon from the Barrie Advance. Do you have a question today?
Yes, thank you. Dr. Gardner, you mentioned earlier that the case count today is at levels we haven't seen since the third wave. When I hear the third wave, the first thing that goes through my mind is lockdown measures. Are we going to get to a point anytime soon where we may be seriously considering something along those lines?
Well, certainly that's not something that anybody wants. And we've had, I think, clear signals from the province that they do not intend to go there. When I look at the actions taken in Sudbury, that really wasn't a lockdown. That was merely putting in place some of the capacity limits that had been set before October 25th. A few other measures as well, but not anything like a lockdown. So even there, where they've had much higher rates than here, they haven't gone in that direction yet. I guess we have to take things as they come. I am hopeful that we have a sufficiently high degree of protection with the immunization, and that we will continue some of the really key basic measures like mask use and distancing, the proof of immunization for accessing non-essential services, that will continue long enough to get us through the winter season. I think what's really important is when you get into the new year, the province's reopening strategy does include discontinuing the proof of immunization requirements, and at the end of March, discontinuing everything. It would be very, very important for the province to monitor closely what's happening with disease before actually proceeding with those changes. We do know from the experience of Scandinavia that you can get large surges of cases if you discontinue all of your control measures, even with a high vaccination rate. So they've had that experience. We need to learn from that experience. We know from Alberta and Saskatchewan, you can even have high rates of hospital admissions and ICU admissions. Mind you, they haven't had as high a vaccination rate as we have, but they still had that experience. So we need to be careful. We need to take this in a measured way. I think slowing down when you see transmission is prudent. I would advise that with regards to the lifting of further capacity limits at this time. I guess at the end of the day, I would certainly hope that we could avoid anything remotely like another shutdown. I am hopeful that the measured approach of continuing much of these control measures, as well as the high vaccination rate, will help us to avoid that kind of situation.
Okay, and one more quick question on Mapleview Community Church. You had mentioned 14 cases among residents today, but how many total cases are there?
I need to, this was from my notes, and I noted that I need to get the absolute number because it was higher than that last week when we included those that were from out of district as well. So I'm going to get that number, and I will make sure that you have it.
Thank you very much.
You're welcome.
Are there any questions from the phone line today? Okay. And was there anyone who didn't have the ability to ask their question this afternoon? Okay. Well, I'd like to thank everyone for their participation today. Dr. Gardner, thank you so much for your update. Our next media briefing will be Wednesday, November 17th. Thank you so much.
Bye, everybody.
Thank you. Bye-bye.
Recording stopped.
Call the Rogers TV viewer response line. Email us or connect with us on social media. This is Rogers TV, Barrie.
I was diagnosed with severe ulcerative colitis when I was 19. It came on as an acute flare, which means that it was very sudden, very unexpected. I didn't have any warning signs before. For newly diagnosed patients, education is really key and finding support. So I would send them to crohnsandcolitis.ca, the national website, so that they can be educated through that forum. And not only that, you can actually be connected with your local chapter of Crohn's and Colitis Canada. And then when it comes to Gutsy Walk, So that is our largest national fundraiser for Crohn's and colitis. And in that, we can raise awareness. That's where we can spread that education around, to help people understand what these patients are enduring or how they can be supportive. Like if somebody can't donate towards this cause, if it's on Facebook, share it. If it's on Twitter, share it, call your friends, talk to your neighbor about it.